No, Emily, the number of adults being diagnosed with depression is growing as we continue to focus on mental health right now. A recent Gallup survey shows it shot up more than 10% from 2015. And that can be hard to navigate for anyone. But how do you approach it when you're at your job? You may think it's taboo, but work culture is changing how it views mental health, and it is likely saving lives.
Suffering in silence at times just because it wasn't part of the norm.
Brittany Moore says she was diagnosed with anxiety from a young age and found support early in her career was hard to come by.
It didn't seem like it was okay to take a mental health day.
But new data is showing workers need those days more than ever. A Gallup survey released in May shows an alarming rise in depression rates across the country, with the highest increases in women and young adults. It's something that came to a head during the pandemic.
Gone are the days where you show up very differently for work because we all were just putting work life together.
Centauri Minor is with Evolved MD, and the goal is to weave in mental health support into traditional primary care, something more companies desperately need.
Right now, businesses are losing tons of money because of absenteeism, because of mental health.
Minor says employers who think having resources or days available will cost them in the end have it backwards.
If you really want to develop a high-performing team, there has to be vulnerability and there has to be that psychological safety.
And Greater Phoenix Chamber President Todd Sanders agrees.
Somebody was having some burnout and the manager says, well, you should just relax. Relax harder. That doesn't work. You don't relax harder. So how do you kind of create structure that allows people to have that time?
Minor says companies can make a difference, and it starts with this one step.
Coaching your people leaders, so your managers, to just be good humans goes a long way.
Prioritizing mental health within the business community absolutely could save lives and is saving lives.
Now, when we talk about saving lives, it could be as simple as a conversation. Research shows just talking about suicidal ideation can help prevent deaths by suicide and help people feel like they have somewhere to turn. And that's why resources like that 988 mental health crisis line is so important.